Jordan, thank you. Chances are you know somebody who's had a stroke. In fact, 1 in 4 people in the U.S. die from strokes every year, and it's usually someone older. But News 5's Lauren Wilson learned there is a shift happening here. So, Lauren, doctors seeing more younger patients now.
I spoke with the Cleveland Clinic, UH, and Metro Health. All three hospitals are seeing more stroke cases in patients younger than 35. And one reason why is connected to the opioid epidemic.
I was getting really bad headaches.
And that's how it can start.
I went to the health center and then they told me that I probably had the flu.
But Ashland University student Sydney Landis was experiencing a stroke.
I didn't know anything about strokes.
Sydney was just 20 years old, considered healthy and active, but she had other risk factors like stress and medication. And she's not the only young person to suffer from it.
But overall, we are seeing younger patients both in the United States and internationally.
Dr. Andrew Russman, head of the Cleveland Clinic Stroke Program, says there are a few factors at play here.
Many of the causes that we see of stroke have evolved over time.
Those causes include rises in obesity and stress, as well as the growing epidemic of drug use, specifically injectable drugs like cocaine, fentanyl, and carfentanil.
You choose to inject the medication, that is going to increase your risk of stroke, because it can increase your risk of getting a blood infection and travel to the brain.
In 2016, the Substance Abuse and Mental Health Services Administration study found drug abuse caused strokes in 15 to 40% of people under the age of 35.
When we use medications that alter our consciousness, alter our awareness, we become less sensitive to some symptoms.
And that's how a patient can mistake their symptoms for something other than a stroke.
Hi, checking in?
Yes. In Sydney's case, she wasn't using any illegal drugs, and she caught her stroke early. So now she's on her way to making a full recovery.
It taught me a lot about, you don't know, you're never guaranteed tomorrow.
Positive message there. Now, Dr. Russman told me not all patients coming in for stroke are actually screened for substance abuse, which is why it can be a challenge to track how many of those patients are actually there. Lauren Wilson, News 5.